Dr. Rountree. I am so excited to be looking at you and thinking about the conversation we're going to have, because when I learned about functional medicine and went through the training program, I got to be taught by you, and you lectured extensively throughout the immune module. And I got to learn immunology again after medical school, but in a much more relevant way and in a way that was applicable. And you just have such a unique style. So I'm so excited that you're going to talk to us and teach us some immunology and what we can do to improve our health. So thank you for being here.
Yeah, my pleasure to be here. It's been an interesting journey because I never thought of myself as an immunologist. I'm a family medicine practitioner, right? But the thing about functional medicine is that it opens doors into all different kinds of ways of thinking. It's really applied systems biology, right? So we don't really think about disease in the usual sense that it's a silo. You know, here's a specialist in allergies, here's a specialist in immune deficiencies, here's a specialist in MS. We just think, what's going on? What's the underlying mechanism and how do we deal with it? So it means that I could go to a conference one day on allergies and one day on neurologic diseases and one day on rheumatoid arthritis, and they would all be relevant.
Absolutely. And with functional medicine, it's like you don't really go specialize in gut health. Like that might be a lot of what you do, but you can't ignore the rest. You do have to understand how the organism works and functions as a whole.
Right. It's all about function and dysfunction, meaning what goes wrong. So I never look at a patient with a condition like MS and say, oh, you have MS. I'd say your body is doing this thing that we call MS, right? Mm-hmm. Your immune system is involved in a dance that we would call MS, but you don't have MS. You are not MS. You are not your disease.
Exactly. And you've just had a long history of working with the Institute for Functional Medicine, and you were one of their original faculty over 25 years ago. So this is not new to you, and you have done so much to spread this other lens to practitioners like me and to other patients who actually listen to your talks and learn from you. So I'd love to know how you view a disease or a condition like MS, and just like overall big picture, like what are the things we want to think about when it comes to treating it? We can just keep it really high level.
Okay. Yeah. And again, I'm not a neurologist, so I don't ever claim that I'm the guy you come to get the treatment. I might be the guy that gives you all the support in addition to what you get from your neurologist. So I'd never discourage anybody from doing that at all. You know, I always work with specialists. But that being said, I'm a systems biologist, right? That's really where I come from. So when I work with a person, I want to know everything about them. I want to know about how they grew up. I want to know how they were born. You know, were they born by C-section? Always surprising someone if, they're 40 years old and I say, well, were you born by cesarean or was it a vaginal delivery? And they go, what? You know, why on earth? And tell me about your mom. Did she smoke? Did she grow up in a toxic environment? Like, why would you care? Because all of that stuff is highly relevant. So if we want to just start diving into what I think MS is all about, it's loss of tolerance by the immune system. And why is that a big deal? Because the immune system basically has some really simple functions. One is to recognize something that's foreign, right? A bacteria, a virus, a fungus. And not just recognize that it's a stranger, but recognize if it's a dangerous stranger. So is it what the immunologist Polly Matzinger said, is it a stranger that does damage, right? So then the immune system needs to recognize that. And the reason is we eat how many tons of food in a lifetime? And there's a lot of things our immune system could say, well, that's not self. You know, that's not part of my gut lining or my joint lining or my brain tissue. So if the immune system wasn't tolerant, then we'd be reacting to anything and everything. And I do have patients that have that problem, that react to anything and everything. that's an issue, right? So the immune system has got to be able to recognize a stranger and then decide, it's not like a conscious decision, but there's actually genetically programmed decision-making process that goes on that allows our immune system to say, there's something wrong about that. So a person that's got gluten sensitivity is different than the rest of us. Most of us that don't have gluten sensitivity or celiac disease can eat gluten, and we maybe have a little bit of reaction to it. Dr. Alessio Fasano at Harvard has done a lot of this research. He says, everybody has a little inflammation when they eat gluten. But for most people, that's not an issue unless their immune system has a little bit more of a predisposition to overreacting. Mm-hmm. So the immune system defends and repairs against injury and against invasion by strangers, but it's also got programmed tolerance. So you've got to have that built-in tolerance.
Tolerance is so important. It's how your immune system knows what to leave alone.
What to leave alone. You got, 39 trillion bacteria in your intestines? And you can imagine if your immune system didn't like them, that could cause a problem. And maybe that's what happens with inflammatory bowel disease. The immune system starts reacting to normal bacteria in the gut. So it's all loss of tolerance. That's the key concept for today, I think, is how does that happen? And how do we bring it back?
Yes. And, we talk a lot about these sterile environments we live in, right? In the first world, like you have to go out of your way to get dirty.
Yes. Yes.
Right? So, getting exposed to ordinary microorganisms is really good for us. So do you want to talk about the hygiene hypothesis?
Yeah.
Everything?
Yeah, I think it was Dr. Strong that first came up with this, an allergist in England, who said, kids that grow up on farms or kids that have a lot of siblings seem to have fewer allergies. David Strong, I believe is his name. And they started looking at that data, and sure enough, it was true that the kids that grow up around farm animals, kids that have brothers and sisters that are touching them a lot, that starts to make a difference when they're around 5 or 6 years of age. In that the kids that were in this super clean environment are more prone to allergies. And in parallel with that, kids that get a lot of antibiotics, which wipe out healthy bacteria in their gut, those kids are also prone to the same problem. So what do the two things have in common? If you're knocking out the normal microbes that should be on the skin and should be in the gut, if you knock them out, especially in the first year of life, right? Something going on in the first year of life, you knock them out, then the immune system is missing information. I'd call it a missing education, right? The immune system has got to get educated. And a kid born by cesarean section doesn't get that same early life education. Now, it doesn't mean if you're born by C-section, you're screwed. There's things you can do to overcome it. It just means that there's a predisposition to immune problems later in life. And that immune problem umbrella always includes loss of tolerance, right? It's because what's the programming? The programming is learning tolerance to foreign invaders and learning which ones are okay, which bacteria are okay.
We need these bugs to expose to and to start teaching the immune system what to leave alone and what to attack. So these exposures are important. And I actually worry about post-COVID obsession with like hand sanitizer. We still have to send our kids sometimes, to places where they request hand sanitizer, and I don't. And I have gotten messages from teachers like, your son didn't have his hand sanitizer. And I'm like, I kind of don't even make my kids wash their hands before we eat. Like, no, they've never gotten sick. Like, do we have to keep washing our hands all day long?
Yeah, I think, is Justin Sonnenberg, is he at Stanford?
I'm not familiar.
Yeah, so Justin Sonnenberg talks about the value of dirt, and he likes to have pictures of his kids playing in the garden and he's a microbiologist, right? And he's like, microbes are good. You need them. And he has pictures of his kid with like mud all over their face and that sort of thing. We definitely are too obsessed with cleanliness in our society. I say that definitely. I'm not saying that hand washing is a bad thing, right? I don't, if I'm going to have surgery for whatever reason, I want my doctor to wash his or her hands.
Yes.
Right? Wash your hands before you start cutting on me, please. You know, if an anesthesiologist is going to put in a tube in my throat, I want that tube to be clean. So I'm not saying we should go to the other extreme that all dirt is good all the time. I'm just saying we've gotten so sterile in our environment that it's created problems. And we know that autoimmune diseases like MS, inflammatory bowel disease, they're all increasing. Why is that? And when they swoop into primitive tribes in the Amazon and they analyze the microbes in their gut, these people have all kinds of things that we've considered dangerous.
Yeah.
Right? You know, they don't just have more bacteria and more viruses. They've got things that if you and I saw them as a patient and we did a stool analysis and found that, we would go, oh my God, you need antibiotics right away.
For sure. And worms and parasites.
Worms.
Yeah, the microbiome is not just bacteria. It's a diverse ecology of just all kinds of microorganisms. So, you know, I'm constantly trying to talk to people about, you know, you don't have to like bleach your house. Like bleach is for the hospital when you're trying to kill HIV and Hep C in your home. Like I have 3 boys. I have my own DIY all-purpose cleaner. It's water and soap. And maybe it's water and vinegar.
Yeah,
like
vinegar, baking soda. That's all you need.
Dirt cheap, and it works. And I'm not over sterilizing surfaces. So these are just simple things we can start doing to bring back the good bugs, right?
Yeah, otherwise our immune system gets increasingly intolerant. Now, you know, that being said, I think antibiotics are probably the biggest offender. I mean, I haven't looked at the stats in a few years, but there was a point where I think at least 50%, maybe 60 or 70% of all antibiotics went to kids under a year of age. And it was mostly for treating presumptive ear infections, right? Kid gets a little bit of a fever. Oh my God, put them on antibiotics.
Yep. I've had that happen where I was like, no. And then, once it was like recurrent, I was like, maybe we could do drops rather than the oral antibiotics, but it's easier just to hand out the medication.
A little amoxicillin, you solve the problem. Then the kid gets better. How do you know if the kid wouldn't have gotten better without the amoxicillin? Right? It looks like, oh, the kid got better 24 hours. Well, maybe if you hadn't given the antibiotic, they would have still gotten better.
Yep. And I know because many times I didn't fill the prescription and I was like, let me just kind of write this out for a few more days. And it was like, oh, we got better. Had we taken the antibiotics, they would have gotten the credit. I'm not saying people shouldn't take antibiotics. There's a time and place, and we should be more conservative in our approach.
I can tell you what I do in my practice. I write the prescription for the Zithromax or whatever. I write the script and I say, wait a day. If you still feel, so you wanted the script, you came to see me to get a script. I gave you the script. You have the script. Now you have it. So put it on the shelf, wait a day. And if you still feel like you have to have it, go get it. So wait that 24, 48 hours, see how it goes.
Do you have any idea how many of them actually fill the prescription?
It's actually a small percentage because I ask people later, they go, no, I never needed it.
What a wonderful approach, actually. So I love that you bring in your Western medicine conventional training and you bridge it with functional medicine. You are well-trained in herbs and botanicals. So you have so many tools in your toolkit. So what are some things that people with multiple sclerosis should be thinking about, whether they're newly diagnosed or not? I think there's like this sense of doom and gloom, oftentimes diagnosed, and it's really hard to wrap your brain around it. What is you as a physician who's treated many patients, including MS, how do you advise a patient maybe with that diagnosis if they're trying to figure out their way forward?
So the first thing I tell them is that getting a formal diagnosis in our society is like trying out for a team. So you're trying out for the team of multiple sclerosis, right? You get some symptoms, you go in, you see a neurologist, they do a brain scan, they say, well, it looks a little off, but it's not enough to qualify you. So you didn't get the jersey, right? Well, once you come back in a year and we'll see if you've got it then. And then you get it and they go, oh, yeah, that's definitive. You have MS. And now you have the jersey and it's welded to your body for life. Mm-hmm. So you're on the team and you can never get off the team.
Right.
So I think years ago, an experience I had with a really good friend of mine who was a dancer. She danced with the Martha Graham dance troupe, right? Really well-respected dance group. But she'd had a few injuries in her neck over the years from dancing. She started developing symptoms that were really worrisome, right? Some numbness, some tingling, some eye problems, some bladder problems. So I sent her to a neurologist. The neurologist did the scan and he said, it sounds a lot like MS, but the scan doesn't cinch the diagnosis. And then I did an antibody test, which showed that she had antibodies against myelin. Mm-hmm. And the neurologist said, we don't believe these tests, right? They don't mean anything. So what? And your scan isn't definitive. But I think you probably do have MS. I just can't give you that diagnosis right now, right? So come back in a year, we'll rescan you and see if you have MS. Now, of course, a year later, she did get the diagnosis. But here's my thinking. Well, what was going on all that time? And so if the specialist is saying either you have it or you don't, that doesn't make sense to me. Either something is not functioning properly in your body or it is, right? And so I want to know what's not functioning properly. If you're making antibodies against myelin, you're making antibodies against the lining of your nerve cells in your brain, that's not right. So if a doc would say, well, that doesn't fit in our diagnostic criteria, so we can't, officially give you a diagnosis, that doesn't make any sense. What we're looking for in functional medicine is signs that things are off, right? We know with autoimmune diseases like systemic lupus that people can make antibodies against the DNA in their body 15 or 20 years before they're diagnosed with lupus. So that means the disease is not a thing, it's a process.
Right.
And as soon as you start thinking it's a process, right? It's something that has gone awry. And what I told her is, I think your immune system has lost tolerance. That's why you have these antibodies, right? And I put her on a whole diet and supplement program because the neurologist said, you don't have MS, you don't need the drugs. I'm like, okay, fine, but you need to do something. Because he said, you don't need to do anything until you get diagnosed. And then when you get diagnosed, we give you the drugs. That just doesn't make sense to me.
Well, that's a function of the tools we have in Western medicine, right? What are our tools? DMTs, steroids. Yeah. And if you can't pin that diagnosis on somebody, how can you give them your tool, your drug?
Yeah, right. You don't fit in the code book.
Yeah. So you got to watch and wait and hope. But I'm like, as a patient, I don't want to hope.
Yeah.
I want to do something because I don't want to get diagnosed. And so that 1 year is an opportunity to make things go a different way.
Yep.
And so what did you do for her? You said you gave diet.
Vitamin D, right? To me, that's the really key thing. But I want to be clear, vitamin D is no cure for MS, right? However, there are a number of studies now that show that low vitamin D predisposes to MS. And what does vitamin D do? It induces tolerance in the immune system. So everything we're talking about, we want to restore tolerance, and having more than adequate vitamin D, not just enough to prevent rickets, but an adequate amount of vitamin D. Certainly I don't want to induce toxicity, but I'm typically going to give a much higher dose than most doctors would give, somewhere around 5,000 units a day. And I've had docs say, oh my God, that's a massive amount. You're going to get seriously toxic. Well, I just checked their blood level of vitamin D. I checked their calcium level, their phosphorus level, their PTH level. It's all normal. So where's the toxicity? I'm not seeing it. So it's where I start.
Absolutely. So it's something to do, and it's a cheap therapy. And, everybody metabolizes like vitamin D differently. I take 15,000 a day.
Yeah.
That's what I need.
You go there.
I got to just keep mine really high.
You got to do it. Yeah.
Do it. So there are things we can do while we're waiting to get or not get the diagnosis. And so functional medicine provides that opportunity to start creating a different cellular environment.
Yeah. So we have ways of assessing how people are doing nutritionally. What's their magnesium level? What about omega-3 fatty acids? We know that people who eat a lot of deep sea fish seem less predisposed to inflammatory diseases, especially if they eat them when they're young, right? And the same thing with the vitamin D is studies I've seen suggest that if you grow up near the equator, right, and you live there until you're about 13, 14 years old, your risk of getting MS goes way, way down. Yeah. So there's something about living around the equator. Is it getting a lot of sunlight and the vitamin D, or some combination of that, and being maybe outdoors more, maybe the microbes from the ocean, or being on the beach all the time? We don't know, but I think it's reasonable to think vitamin D is part of that. So we want to start correcting the things that predispose the person in the first place. Again, I'm not saying this is the cure. I'm saying, but this may help bring you back to where hopefully you could have been in the very beginning before all this started.
Tell me a story about autoimmunity and how that process develops over time. When I got diagnosed with MS, it felt like it just fell on my head. I was shocked. I was like, I'm the healthiest person in my family. How can I get a disease? I'm a doctor.
Yeah.
I can't get diagnoses.
You can't do this to me.
Yeah. And it seemed very sudden, but now I know differently because I went to functional medicine school. And so can you paint a picture of what might happen over somebody's timeline from, early childhood, even from birth, even during gestation, to the time their symptoms may become overt and obvious enough for them to go and seek medical help?
Okay. So one way for me to frame this is to say that we have this blueprint in functional medicine of antecedents, triggers, and mediators. Okay. It's a really fundamental way of thinking. So the antecedents are the things that predispose you to getting sick. What goes wrong? So, obvious example, junk food diet, or cigarette smoking, or living close to a highway. And I'll show what that connection is. Or as I said, if you grow up around the equator, then it's the opposite of an antecedent. It's a beneficial thing. It makes you more tolerant, makes your immune system more tolerant. So the antecedent is the thing that sets you up either to get a disease or not. And genetics are the obvious thing, but diet, environment, lifestyle, all those things feed into it. And then there's triggers. There's things that set off the immune system in a person who's already predisposed, right? And Epstein-Barr virus is probably the best known trigger for MS, but there's probably others as well. And then the mediators are the chemicals that the immune system makes in response to being triggered. And that in modern medicine is what we treat, right? We see an overproduction of a protein called tumor necrosis factor alpha in a lot of autoimmune diseases. So we make a drug that inhibits that. So, that's the big framework, something that predisposes a person, genes, lifestyle, diet, then something that triggers a person who's predisposed. And then if that trigger goes on over and over and over again, it's usually not just once. It's over and over again. Eventually, a switch gets flipped in the immune system, and it starts to spew out these toxic chemicals. So here's a story that I think is pretty fascinating, which is the connection between cigarette smoking and autoimmune diseases, especially rheumatoid arthritis, but also MS. So a number of years ago, I got really hyper-focused on this risk factor of smoking. Well, wait a minute, this would mean that rheumatoid arthritis is starting in the lungs, right? Mm-hmm. If cigarettes, so the number one risk factor for rheumatoid arthritis is having smoked, and it increases the risk dramatically. And so you have to ask, well, what's going on? Well, one of the first test that we do to try to diagnose rheumatoid arthritis is called the anti-CCP. It's an antibody against a certain kind of protein. And when that first came out, like, this is typically what happens with a doc. They go, doctor, here's a new test. This is the test you do. And I think, why do we do this test? What does the test mean? Oh, well, you don't need to know that. Just know that this is the test that's approved to diagnose rheumatoid arthritis. But I started questioning what the test means. So it's an anti-CCP. It means antibodies against citrullonated protein. And you go, oh my God, very technical here, okay? But citrulline is an amino acid, right? It's in our diet. It's in watermelons, right? So why would we be making antibodies against that? Okay, well, there's another amino acid called arginine. And a lot of proteins on the surface of our membranes, et cetera, have arginine in it for very complicated reasons. Don't worry about why. Just know that in the lungs, there's a lot of this arginine amino acid that's hanging out. Turns out there's an enzyme that gets activated by toxins like cigarette smoke, right? So the enzyme, for reasons we don't understand, takes that arginine and substitutes a citrulline. Okay. Trust me, I'm going somewhere with this where you'll go, okay, this makes I'm good. So smoke activates this enzyme. The enzyme then swaps out the arginine for citrulline. Suddenly your immune system goes, I don't recognize this protein. Yeah. Oh, it's a citrullonated protein. So I don't recognize it. It must be a stranger. And, the cigarette smoke is causing damage. So there's a stranger and there's damage going on. So dangerous stranger. And let's say this person smokes every day for years, right? So day in, day out, the immune system is going, I don't know, that something's not right here. This weird protein keeps showing up over and over again. And eventually a switch gets flipped and the immune system starts saying, I'm going to make antibodies against citrullonated protein. Right? But it starts there. And then that immune system, if it's still activated from all the smoke and toxins and maybe not enough vitamin D or enough omega-3 fatty acids from fish oil to keep a damper on things, the immune system starts saying, well, I'm just going to react to that citrullonated protein. How about everything around it? And in the case of rheumatoid arthritis, we think that antibody starts getting made in the lungs, but then it says there's another protein really similar to it in the joint. Mm-hmm. So it starts attacking the joint, and then it starts attacking all the tissues around that abnormal protein. So the way I describe it is that this toxic habit of smoking creates freak molecules, strange molecules, and it also creates a dangerous scenario. So the immune system goes, stranger danger, stranger danger. And if that happens day in, day out, eventually it loses its tolerance and it starts attacking tissue. Now, while I talk about that story, we're discussing MS today. It turns out that same enzyme is found in the brain. And that same enzyme converts the arginine in myelin into citrulline. And these same antibodies that have been used as an early diagnosis for rheumatoid arthritis are now being investigated as an early diagnosis for MS. So it looks like a very similar process. One of the risk factors for MS is cigarette smoking.
It's a huge risk factor, yeah.
It's a huge risk factor. So how would smoking affect what's going on in the brain? Because the smoking damages the tissue lining the lungs, activates that enzyme that starts changing the molecular structure of the cells lining the lungs. The immune system says, there's danger going on, there's stranger going on. I'm going to go all out. Okay, well, there's one little problem, which is the immune cells can't get into the brain. Right. So you've got to have one other predisposing factor, which is leaky brain, right? What we call the leaky blood-brain barrier. if that blood-brain barrier is leaky for nutritional reasons or genetic reasons, there's a list of things that can cause a leaky blood-brain barrier. And when people say to me, I don't believe there's a blood-brain barrier, well, have you ever had a glass of wine?
Oh yeah.
And you've ever noticed that? Example. Right. You drink something, you feel it. But then a more sensitive person would say, I can eat a cookie and I feel it in my brain. Mm-hmm. An even more sensitive person could say, I have a piece of bread and I feel it in my brain. So there are clearly people that have a leaking in the barrier in the brain. So now you've got a scenario where the immune system is overactive in the lungs to that cigarette smoke and the altered tissue. And then that transfers over into the brain. Those immune cells get in the brain. And guess what? The smoke can cause the same problems, can activate the same enzymes in the brain. So is that the beginning of MS? Well, there's one other piece of evidence to this. Another risk factor for MS is exposure to solvents, right? Things that we inhale. So it's not just cigarette smoke, it's things that we inhale that can cause similar damage. So even in the absence of smoking, the solvents can damage tissue and over time set off the same kind of immune response. And if there's leaky brain, the leaky brain barrier, then again, it can transfer over. Now, one of the drugs, as you know, that's used to treat MS today, basically plugs up the leaky brain barrier. The idea is you plug up that barrier, the immune cells can't get into the brain, and it can stop the inflammatory process. So, the scientists know this is going on. I don't disagree with that at all, but I just have to back up and say, well, if we know that's the case, what's the big picture here? What's this whole process that we're talking about?
So that's a great story, right? Of one factor that can set off a cascade of events that can drive the immune system to produce antibodies and eventually get into the central nervous system and cause myelin attack. And as you were telling the story, there were like multiple factors that are within our control.
Yes.
Right?
Multiple. Not smoking.
Not smoking. The things that have been set up for us, like our genetics, like we can't really change our genetics. We can alter what genes are being expressed or turned on based on the foods we eat and all of the different behaviors we carry out throughout the day, how much we're sleeping, how much we're exposed to stress. So genes are not enough to get an autoimmune disease. You need multiple hits along the timeline. And there's this process that has to be driven forward by various triggers multiple times, right? You get a viral infection, maybe it's EBV, and then maybe later it's COVID. I mean, there's some data on COVID, not as strong as EBV data. And eventually you might have a strong enough event. Like for me, it was a very stressful job. And in combination with not sleeping, eating hospital food, and postpartum. It was within the first month of having a baby that I experienced my first symptoms. So it was the perfect storm of this nasty soup that drove that process forward. I made antibodies to myelin, and the attack happened in various areas of my central nervous system, and I had certain symptoms as a result. Yep.
So it's a process. And you didn't get a jersey welded to your body that you can never take off. And the perfect example of that is our friend Terry Walls, Dr. Terry Walls, who was confined to a wheelchair, who did all the right conventional treatments and just got worse and worse, and finally said enough of this, and changed her diet, really started getting into a super healthy lifestyle. And I have danced with Terry Walls, right? I mean, rock and roll, jumping up and down, and here's a person that was in a wheelchair. So it can happen. There's a possibility that once you say this is a process, not a thing, like, I tell parents all the time, your kid doesn't have measles, your kid is measling. Like that. It's a dance. It's not a thing.
And I think of autoimmunity as like a gradient where you're not like you either have it or you don't. Like you can move back and forth. When I'm traveling and eating bad food and I'm not sleeping and, not doing my normal routine, like, yeah, I feel worse.
Yeah.
And when I stick to my good routine, my symptoms improve.
Yeah.
And it wasn't until I, kind of figured out, I landed at an integrative medicine conference, and that was my first exposure to anything outside of conventional medicine. And I thought, let me try what these people are saying, because what do I have to lose? And then I did it. And then I had the personal experience of like my left arm and hand being so much better. And then, one thing snowballed into another. It was functional medicine, and my lens kept, growing. And I had different ideas about treating different diseases. And so I find these tools really useful because it gives people agency. It gives them hope. And I want people to know that MS doesn't have to keep progressing. Like we can slow it down. We can improve symptoms. You may never get that diagnosis removed off your chart. And that's
right.
Right. But we can try to make you live with more quality of life, more ease, more joy. And to me, those are signs of healing, not curing, but healing, create a healing environment in your body.
So I just remember in the AIDS, back in the AIDS days, when we had a lot of people that were getting treated and were pretty stable. So they started talking about what they call themselves. And so they started saying, we're people living with AIDS, right? PLA. So now what I do with some patients is I say, you're a person who had X disease. Yeah. I'm a PWHMS, right? Yes. A person who had it, just as a way of thinking, because I've seen people that went into remission and then they saw the neurologist and the neurologist said, well, you still have it. And that's really not a healthy way of thinking.
Yeah. You have a propensity towards wanting to attack your myelin.
And I do want people to understand, like if they go on a supplement regimen and their symptoms get better, go away, that doesn't mean they should stop the supplements. And I've seen that happen. I've seen people get dramatically better and then go, well, I'm fine now. I don't need the vitamin D. And I'm like, oh, no, you're missing the point, right? Your body has been on a journey to not a great place, and it needs a little extra help staying back in balance.
And we owe it to ourselves to stay on that path of like keeping our health in that good place. And what are some of your favorite supplements when it comes to autoimmunity in conjunction with lifestyle?
Well, this one might surprise you, but at the top of the list is broccoli sprouts.
The actual sprouts, or
the actual sprout. The 3-day-old sprouts seem to be the best. So this is a very long story for me professionally, but just say many years ago, decades ago, I got to meet the researchers at Johns Hopkins that basically discovered a chemical in broccoli called sulforaphane. And they found that sulforaphane turns on all kinds of beneficial enzymes inside the cell. Right. And one of those enzyme systems is called the NRF2 pathway. Mm-hmm. Right. It's NRF2 is it's not an enzyme, but it's a protein inside our cells that recognizes whether there's an excessive amount of free radicals or not. That's not the relevant thing. The relevant thing is there are a lot of foods that we can eat that turn on this NRF2 pathway. Right. And NRF2 turns on all kinds of beneficial things in the cell. It makes it stronger, more protective. It turns on enzymes that detoxify, that get rid of bad things. So I've been following that research for decades. Then all of a sudden, this new drug comes out for MS called Tecfidera. You know about Tecfidera, right?
Yes.
It was based on old research on dimethyl fumarate, right, which is whole other story. But then I look at the mechanism of Tecfidera, it activates NRF2. And I go, wait a minute, we've been doing this with broccoli sprouts for years and years. Yep. Right. Now, yeah, you can get the same thing from eating broccoli, but you got to eat a lot of it, lightly steamed, at least a half a pound of broccoli or Brussels sprouts, cabbage, all the brassica family. The broccoli sprouts do the best job. right?
Oh, I
but for
didn't
people
know
that
that.
just say, excuse me,
I didn't know that. And the funny thing is, just 2 days ago, I started making my own broccoli sprouts.
yeah, terrific stuff. You want to try to eat a handful every day.
Okay.
Now, I've never seen a study that compared people who took Tecfidera to people who took a handful of broccoli sprouts. I can't give you that claim. I can just say, after working with broccoli sprouts and broccoli seeds and all that for a couple of decades now, that I've seen some pretty amazing things. So that NRF2 pathway, that's something you want to turn on. And I frankly don't quite understand why the Tecfidera comes with toxicity, because it must be doing other things that we call off-target effects, right? So it's got to be doing other things we don't want. Whereas broccoli sprouts don't do anything we don't want.
Food is physiologic. Like, it's just going to help you, and it comes with so many nutrients. Our drugs are potent, and
Yep.
they have really powerful effects on one pathway.
Yep.
And NRF2 is just one pathway. There's so many other ones.
So many. So we're working on the system in functional medicine. We've identified NRF2 as a particularly important beneficial pathway that we want to turn on. There's another pathway called the NF-kappa B pathway. That's the inflammatory pathway. So, okay, that's technical, but ibuprofen turns that off. Steroids turn that off. Prednisone turns it off. Dexamethasone turns it off. But obviously, you don't want to take dexamethasone or prednisone for years on end, because it will thin your bones. It will cause an increased risk of fracture. There's a lot of downside to that. So are there other ways to slow down NF-kappa B without turning it off? And one of those is a chemical called curcumin, which is kind of my second favorite thing. Curcumin is an extract of turmeric, right, which is in curry. So you might say, well, what about curried broccoli?
Ooh.
Absolutely. Curried broccoli, curried Brussels sprouts. If we're following a food first strategy here, then that's the way to go. Is to really load up on these plant-based chemicals. But which chemicals specifically? Curcumin, sulforaphane, right? And what are they turning on? Well, curcumin actually turns on NRF2 and turns down NF-kappa B. So I'm saying this, not because the technical stuff, but it's like there's a technical level to this if you want to dive into it, but there's a very practical level of what should I eat? What should I do? Eat curried broccoli, eat broccoli sprouts are even better. And then there's, the deep sea fish, the wild salmon.
Yep. You can't go wrong with loading up on plant-based foods, adding in fish and seafood for the omega-3 content, and just being open to new foods, new tastes. It's a process, right? It takes time for people to do that. But I think it's really the foundation of starting to clean up our cellular health and to create a more healing environment so that our biochemistry can actually tend to regeneration and repair rather than fueling the fire of inflammation and, doing things that are not promoting healing.
Well, our immune cells are like every other cell in the body. They need nutrients. So, if we're assessing the immune system in terms of one pathway that's gone awry and is overproducing an inflammatory chemical, a cytokine, as it were, TNF alpha, something like that, if that's all we think about, then we're missing out on the big picture. And the big picture is, what does the system need to thrive? How do we restore tolerance? And how do we make sure that our immune cells are back in balance? And again, that NRF2 pathway, I call it the broccoli pathway, that seems to be really critical. And then the other critical part of it is making sure that the microbes in our gut are in a really healthy balance.
Yep.
Right? There's a number of studies now showing that an imbalance of gut microbes predisposes to MS and probably drives that inflammatory process. So that means we want to make sure the person's got the healthiest gut bacteria possible.
Absolutely. And it's not as simple as just dropping in the bugs that we think that person needs, right? So yes, there's the supplement approach, which there's a time and place for that. But again, I think food first just makes you go further if you're eating fermented foods to supply the good bugs, and then prebiotics, which are the right kind of fibrous foods that feed your good bugs so they can grow and thrive and take up space and outcompete the not so friendly guys.
Okay, I'm going to drop a name brand here, but there's this fermented kraut that's called wild brine. And I don't know, I'm like, I don't know what it is, how they do that, but I start thinking about eating some, right? I'm thinking about it right now. As soon as we're done, I'm going to go up and have a big forkful, because there is something about that stuff that is so delicious. I don't know what it is, but it's magic.
It is. Even my kids like it. Like we'll go to the store and like, Mommy, can we get that fermented stuff? Right. Yeah. And I found a new one. It's like a purple. I haven't tried it yet. That I actually just saw it. It's like the red cabbage, I think, or something. I'll have to tell you what it is. But
yeah, maybe I'll get some today.
Yeah. And it's like a spoonful, right? Yeah. Not even a bowl of this stuff. It's like, my family's Iranian. So I kind of grew up eating pickled foods or fermented foods on the side of everything. Like everything, or yogurt. Like,
yeah, yogurt is terrific food. Hummus is really good food. So we need to always start with this food first concept with people, because, unfortunately, in some circles, functional medicine is thought of as supplement heavy, right? You see a functional medicine doctor, they're just going to give you a big bag of supplements, and that's the end of the story. Well, I recommend the vitamin D. And for people that don't like wild fish, I tell them to take the omega-3 fish oil, fatty acid supplements. Yeah, I do that if people can't do the food, but you start with the food, and then the supplements are supplements, right? They're supplements to the food. And so we were talking in the beginning about the excessive hygiene, and part of how you restore the microbes is to eat these fermented foods and eat a lot of prebiotic fibers. Turns out potato starch, who would have thought potato starch is actually really good for your gut microbiome?
Yep.
But I'm big on it.
These foods are out there. You just have to look them up online or find a reputable source and just start eating them. It's dynamic. It doesn't take 6 months for the benefits to show up. Things are happening at the microbiome level within days of you changing.
Within days, it starts to change within days. And why would we care about what's going on in our gut? Because just like what's happening in the lungs, if the lung can set off the cycle of inflammation that ends up in the brain, the same thing can happen in the gut. If there's a cycle of inflammation that's starting in the gut and there's a leaky blood-brain barrier, then, you're set up for that process. So that's why, even though if you look at the data on gluten, it's not entirely clear that gluten is a well-established trigger for MS, right? But even so, I still think most people with MS, or who, like I said, I don't say with MS, right? Most people who have been told you're leaning in that direction, I think should probably be on a gluten-free diet should at least try it for a while. I'm not saying never eat it ever again. Just, try it for a few months and see what you notice. So there's inflammatory foods and anti-inflammatory foods, in other words.
There you go. Yeah. And I was not gluten sensitive for years. And then during the pandemic, stress, kids at home, homeschooling, me, do all the things that I do, I became intensely gluten sensitive. But what's interesting is, like, it got better, and I can now tolerate some gluten. But what I've realized, and I've known this forever, but it's not the most nutritious food anyways. When you're eating a lot of gluten, you're not eating vegetables, because you're like pasta and salad.
Yeah.
So it opens the door for like new foods. And everybody's different. Everybody's got to do the experiment of cutting it out, seeing how they feel, and then reintroducing it and deciding.
Yeah. So at least try. That's all I'm saying is, like, at least consider that and give it a try. I'm not rigid about it at all. But the bigger principle here is starting to ask yourself, are there things my body doesn't like? Are there things it does like? For me, I like that wild brine fermented kraut. I just crave it. But there are other things that I know if I eat it, I'm going to pay a price for it later. And so start keeping a food diary, paying attention, and noticing that that's something that could make a big difference in the long run, right? Because these are processes that go on, as we said, for days, weeks, months, and years, right? So if you're eating something every day that your body really doesn't tolerate well, that can translate into a much bigger problem at some point.
For sure. And autoimmunity, MS, food sensitivities kind of tend to go hand in hand. It's kind of like the same underlying process of your immune system losing tolerance, getting pissed off, and starting to attack things it's not supposed to attack.
Yeah, exactly.
Well, thank you. This was a fabulous conversation. Thank you for the education and for explaining something really complex in a way that is digestible. And it's so important for people to actually understand that process of autoimmunity, because once you understand how it goes forward, you can start doing things to push it backward, and to feel better. So
one thing I'd point out that I think is really important is if you, quote, go off the wagon, right? Go out and have some fast food for the evening and then say, I don't feel so good, I'm having a little more numbness or something like that. Don't berate yourself, right? This is what we're looking at, is a process that develops over long periods of time. So yeah, if you fall off the wagon and eat a meal that maybe wasn't the greatest, say how much you enjoyed it. Okay, that was great. I got some fries in, it's wonderful. But maybe the next day you think, I won't do that again.
It's such an important point, because I think we beat ourselves up a lot for not being perfect. I tell my patients, I want you to be perfect 90 to 95% of the time.
Yep. Yeah, exactly. Enough hood.
Yeah. Because, like, it's my kid's birthday. Yeah, I'm going to eat.
Have some cake.
I'm not going to have 3 pieces like I used to.
Yeah. You've got to enjoy your life. Yes. And you've got to, in the bigger picture, acknowledge that, you're a living, breathing being. You are not a person with this disease, right? The label, the jersey, put that off to the side and live your life.
Yeah, because that jersey is just one dimension of who you are. There are so many other dimensions to us that we could really bring out and nourish and nurture. So, you don't forget about taking care of your health to keep that process silent, but don't forget about the rest of you.
Yes, don't forget about the rest of you.
Thank you so much. I love talking.
My pleasure.